protocols and try to follow the SOPs, and then try to make business continuity plans for all functions. So this is how it started. And then from there on, there is no full stop, even till today. So situation changed. There was a first wave, then there was a pause, then there was a second wave. We are heading towards the rollout of vaccines as well. So there are so many ups and downs during this phase. Now there are pros and cons of the vaccination as well. Shall we go for it? Shall we not? That's another debate. So yeah. So this is how what is happening around us as of now.
Yeah, I think it's an interesting time for everyone, Hajira. Like you say, I think in any way, shape, or form, everyone around the world, has been has been affected by COVID in some way, whether through loss of loved ones, through ways it's affected their household or their livelihood or their work status, or even businesses for that matter, and obviously governments included. And obviously not to forget the development sector and the struggles they've had. So yes, I think it hasn't prejudiced or discriminated against anyone regardless of their class or their background or their education status.
True that.
But one thing I have seen that's been my experience in many of these conversations that we've done, and we're on our third SDG related conversation, but this is probably conversation 50 we've had in the last year, that there's this sense of togetherness. And I think we're moving towards unity. So it's been a really interesting time. Assalamu alaikum, Umair.
Assalamu alaikum, how are you?
Good, alhamdulillah. Good to see you. You're looking well, mashallah.
So are you.
Well, I have the good beard, so I'm not too sure about that. But thank you for joining us. And I know you had some technical issues, so let's get started. So welcome to both of you for this In Conversation series. This is our third In Pakistan In Conversation series on the SDGs. Obviously, this is goal number 3. And this webinar forms part of the UN's Decade of Action, and the Global Compact's In Conversation series has become this really unique and amazing platform to amplify the issues and the challenges that we've touched upon earlier in our earlier kind of global settings. The UNGC acts as the outreach and engagement hub, as you know, and our members do, that connects people and organizations who are reshaping the next decade through impact, purpose-driven leadership, and obviously adoption of the Sustainable Development Goals. Our office in Pakistan it responded to the UN Secretary General's call to action by creating this platform for inspirational leaders such as yourselves from all walks of life. So it's not just big companies, it's entrepreneurs, startups, everyone. To share their inspiring stories. So it's really for us to hear from you, and also to activate others as well, but activate them to action. So we're moving from conversation to action. So this platform centers around a movement of people doing good, supporting others to do good, and who can become catalysts for shaping this next decade of action. And whilst this year, most discussions, we're just talking now, primarily focused around COVID, now's a chance to really reinvigorate and activate as we sort of move strongly into 2021. So there'll be more conversations over the following months. We've got our regional session next week, which we do with Nigeria and UAE offices, our colleagues Naomi and Rachel. And then we've got our event, the SDG Summit and Business Sustainability Moot, towards the end of the month. There's a whole load of other stuff happening before we get into the Leaders Summit that's being hosted live from New York in June. And we'll continue these conversations and many other conversations as we roll out the SDGs Roadshow in Pakistan and, of course, our SDGs Accelerator program. So these conversations are here now. And your insights, what we learned from you today, will help shape some of those agendas as well. So what you say is not just valuable for us in terms of who's listening right now, but they will be valuable for us in terms of what we do next as the Global Compact. So we're going to keep this conversation light. That's why there's just the two of you. This is a gupshup amongst friends. And as I was saying earlier, if you have your coffee or your tea or ruafza, whatever it is that you feel comfortable with, this is all about you, your insights as global change makers. And this is an opportunity for us listening in to hear your insights of what you've been doing to activate your organization, your networks for doing good, and also what you've been doing for the SDGs specifically. And we'll use this to form a discussion around what more can be done for people who wish to be role models, how we can motivate them individually and collectively, and how can this session then become a springboard for what happens next. So we'd like to understand your sustainability journey, the pivots that you've had to make around COVID, and obviously describing at what point you realized you had a much bigger role to play. So that sets the kind of premise and the context. So for those people listening in, this is live, but the session is being recorded. You can watch this replay back on Facebook and YouTube. And we would just ask that if you are social media friendly and social media savvy, that you do post on LinkedIn, remembering mentions and handles. And those are at Global Compact Network Pakistan, United Nations Global Compact, and obviously anyone else that you can think of. Other hashtags to use are Decade of Action, SDGs, and In Conversation With. So today, we're joined by Dr. Hajira Murtaza and Umair Azam. Hajira, you're from Nestle, Pakistan, and Umair, you're from Integration Experts. Thank you for joining us. For people listening in that want to connect with either Hajira or Umair, please find them on LinkedIn. That's the best way to do it. Reach out to them, ask them more questions about what they're doing to change the world, and see if they can inspire you to do your bit. Okay, so let's get started. So I'm just going to ease in with a couple of general kind of style of statements, as it were, just to get a little bit of understanding of what you've been doing. Hajira, I'll start with you first, if that's okay. So,
sure.
And like I said, there's no specific kind of stance. It can be your own thoughts and ideas, what you're doing as an organization, or what you think should be done as well. So I want to try and get under the hood, as it were, or the bonnet of the car, to use that analogy, and what the SDGs mean to you. So I'm not looking for the definition per se, but what are the sustainable development goals to you? Why are they important? And that will just give us a bit of a flavor of, why it is that you're doing what you're doing. Hajira, you first.
Thank you so much. So, first of all, I'm really thankful for being called upon here at this forum and sharing some insights on behalf of my organization and my insight as well. So, I'm Dr. Hajira Murtaza. I'm working with Nestle Pakistan. I have got a history of for the last 13 years. Currently, my role is Market Occupational Health Manager for Nestle Pakistan and Afghanistan. Occupational health, well-being of our people, and like we say for Nestle, the slogan is "Good food, good life." So we always believe in that for our employees and for our consumers, there has to be the perfect blend of both, being it food or being it health. When we talk about health, as we all know, that it's divided into two. It's not only physical health, but then it's mental health as well. So Nestle's aim is to give that comfort zone to the employees where they can enjoy not only their physical well-being, but they should be in a less stress-free environment where they can enjoy working. And for that, there has been series of things that we have been doing for the employees. My current role has started in 2017. So since then on, there has been a platform that's providing our employees for different kind of awareness sessions, which includes common diseases, heart issues, diabetes, blood pressure, Some of them are being conducted by top consultants in Lahore. Some of them are being conducted by my own self. And then we try that all the questions and all the current issues related to their health should have been addressed either during the sessions, or again, they can connect with the consultant and other platforms that we provide to them. We give our employees an opportunity to know their numbers. By knowing their numbers, we mean that every employee should know where their five basic things do stand, which includes their blood pressure, their diabetes, their lipid profile, and then we go for their weight, hip circumference, and obviously their BMIs. So these are the things that, because we all know that the basic thing should be ruled out. So
I think there will be some.
where your inheritance or your current eating habits or your lifestyle will take you to. So at least there should be some basic information that we should have of ourselves in our pocket. Other than that, for our factories, we have got a huge setup. We have got labor, we have got employees, which includes the many thousand in thousands. So for them, their health surveillance once in a year is mandatory. This includes our food handlers. This includes those who are working at height, those who are working in high noise areas, and so on and so forth. So there are different categories. We have drivers, we have got chemical handlers, we have got other occupation related employees which are working in the factories. So we make sure that the factor of having any occupational health hazard should be ruled out. So health risk assessments of those areas are also being conducted, and along with that, their health checkups are also being done, and then the follow-up. Of course, then there are a series of things that we have been doing for them. Talking about the last 1 year, since, like I said earlier, that it has been a roller coaster ride for all of us. There have been ups, there have been downs. COVID was very lethal to some, and a few of them, they have lost their loved one as well. A few of them, maybe amongst us, we have experienced it ourselves, unfortunately, also. So we have an idea that how hard it was to get through this phase. Moving forward, currently we have this news that the vaccination is coming up. Having said that, we should also be mindful of the fact that is this vaccine 100% cure? The answer is no. Is it going to provide us a lasting immunity? The answer is no. For how long the antibodies will stay in our body? The answer is we really don't know. Even having the vaccine, will we be able to get this infection or this virus in our body? The answer is yes. Why do we want to get this vaccine, if at all? Because there are so many no's in this line. So the answer is that there is a probability, there is a chance that if we get it, and after 1 or 2 years, there is the data that's been collected on all those who have been vaccinated. There is a bright chance that maybe yes, it will show some kind of relief, that there is a protection. There can be protection that even if you are safe, you are not communicating it to others. If you are asymptomatic, it's going to stay in your body and not communicate to others. But still, is it a yes or a no? That's a question mark. Like WHO says that COVID vaccine or COVID antibodies is not an immunity passport. So we have to be mindful of this. Having said that, every prevention is a better thing to do. So decide for your own self. And if you think you should go for it, go for it. So this is little something, from my side.
Wow. Clearly a really kind of strange scenario we're in at the moment. I'm just going to go back to my primary question. So thank you for summarizing exactly what you're doing, and you've actually answered the other two questions I was going to ask you anyway. So that's helpful because that brings you back to that. But why is this particular SDG, so goal number 3, which knows health and well-being, why is this important to you so I get the organizational sense, but why is it important to you, Hajira? इसमें कुछ है? Do you feel connected to this? वो कहते हैं ना दिल से or kindred spirit. connected to that this was your calling anyway? You just happened to be in the right place, right place, right time. Is there something significant about?
I think Zubair being a doctor, yeah, exactly. So being a doctor, that's the first thing, empathy for people. Having that inner feeling that yes, we want to achieve something, we want everybody to be healthy around us. In the hospital setup,
so you're naturally inclined towards this particular
of course,
sustainable goal anyway, because of your profession, right?
That's true.
Makes sense. And you mentioned that obviously things around vaccination and things like that. We'll come to that a little bit later on. It's been interesting to learn just generally from our colleagues in other UN agencies and obviously the private sector and government that this whole kind of way around COVID has been an acceleration of this particular goal, good health and well-being, goal 3, as we know. And it's really kind of put the focus on how we need to look after ourselves a little bit better and a little bit more. So it's done 2 things. And it's really kind of helped us all recenter ourselves that if we look after our health and well-being, then we stand a better chance, not just at fighting COVID, but everything else as well. I'll come back to that in a moment. Umair, I want to jump across to you and kind of ask you the same question, really. Why is this particular SDG, Goal 3, good health and well-being, why is it important to you? And I know you do work in this sector, so we'll come to that as well. But as an individual, what's your kind of connection or your feeling or your sense of, how can we try and understand what that means? So others listening in who are thinking, where do I start the journey? Think, maybe to Umair ki tarah hoon, maybe to Hajira ki tarah hoon. Yes, so you know what? I should start this.
So first of all, thanks Umair, for having me on this and on this platform, and it really is a pleasure to talk about health and well-being, and it was great hearing what Dr. Hajira had to say. Personally, if you ask me, I'll get to like you said, I'll get to the company vision later on. Personally, I think I myself have gone through a very serious transformation, right? And that was also related to health and well-being. You've seen me, very differently, I think, a couple of years ago, right? So, if I sort of connect this particular goal for myself, I think, I've realized and I've lived through this goal myself, you see, in the last, I would say 18 months, where I personally realize how important it is to actually practice this in your daily life. I don't know, but the fact that I've dropped about 60 kilos from my own self, right? Where I was at a certain weight, and I've taken that weight off my body. I feel personally much better. I think I've been able to, inspire a lot of people. I think that gives me a lot of encouragement to keep doing this. Of course, I think I still have a certain, I would say, because when I thought of this, that because I've lived my 20 years of my life in a certain way, you see, and that was a life that I enjoyed. I mean, and I did whatever I wanted to. But I think what sort of defined me, or what was a defining moment for me, was that how do I want to live my days to come, which, right? So the fact that it's so important to basically change your lifestyle, right? So if I talk about health and well-being, it is a complete transformation. You have to think clean, you have to eat clean, you have to live clean, you have to have a certain discipline in your life, right? That you need to follow, which basically allows you to inspire others. And personally, I've been on many discussions, many forums. Internally within my company, a lot of people come to me and ask me that how am I able to transform this? I'm not young. I'm 43 years old. So for you to change yourself at this age, it was never easy, right? But I think you have to start somewhere. And the moment you start, and it's all in here, right? It's all in the head. So the moment you decide you want to change, I think, and I think whatever the SDG goals are, you have to start from within first, right? Some of the goals that I feel are reflecting in your own self, right? It's a reflection of yourself to the society. Okay. So I think if you are able to do that, then of course you are able to basically then inspire others or guide others or coach others. So I think personally, I think it is very, very important that you focus on health and well-being for yourself, for the people around you, whether it's your own family, whether it's your colleagues, whether it's your friends, it's your professional circle, it's a social circle. You need to keep educating those people.
Yeah.
And ways.
And do you think, Umair, that? Sorry,
yeah, sorry, go ahead.
Sorry, I was just interjecting.
Sorry,
you raised the point. You raised a really good point there, that you had to feel it from within, and I think that's one of the things that when we speak to our member community of Global Compact members, but also outside of that as well, of organizations that are looking to start the SDGs. Certainly when we speak to owners of business or CEOs, they're kind of springboarding one of the goals because it means something to them. And that's kind of really my point to those listening in and those thinking of starting, on the SDGs journey and looking at impact within their business. Maybe, just based on what you were saying, maybe it's easier for some organizations to think, okay, mujhe kya cheez say, what's my connection? What resonates with me? And maybe start with that. I want to know, has it then been easy to, obviously it's become a little bit easier, and I don't mean easy, but possibly a bit easier to champion this particular SDG in the company, because of what's happened drastically physically, so it becomes natural. Right. And different to Hajira's championing the SDGs in her company. But I just wanted to ask you, do you feel that everyone is on board of this SDG goal 3? As a company, everyone's behind you. So it's moved from being hame kuch karna chahiye to, as an organization, this is now reflective of your kind of direction.
Yeah, and absolutely. And now consciously in every town hall meeting that I do, or even when it's just the management committee sitting, it's default that we have to have this discussion about how important it is to have a healthy lifestyle, and the fact that people, they keep asking me a lot of questions for how, one needs to sort of discipline themselves, right, around health and well-being. And the message is across the organization. So every time that I feel that somebody, just talking to my own colleagues and on my own team members, I keep sort of stressing on this, that, you need to take time out for yourself during the day. We're all busy, we will always be busy, right? So the fact that Even, if somebody is working 14 hours a day, it's very easy for them to make it 16 or 18, right? Depending on how involved you want to be. And this leads to, this is another thing that and this is something that as a leader of my organization, I keep stressing on this, that people need to be empowered, right? And when they are empowered, let's say when I am able to empower my direct reportees and they are able to empower their reportees, we're already sort of giving ourselves a little bit of more time during the day to think, right, for ourselves, right? Because if everything is going to come to me, then I don't need to have 140 people in my company, right? For example, if we're a technology company, 140 people, those people are not needed if everything needs to be looked in by myself, right? So, and that just leads to the conversation of having a little bit of more time for ourselves. So, when I was living a certain lifestyle, I always thought that how can people take time out for going to the gym or walking in the evening or cycling. There are many people who do a lot of these physical activities, right? So would always find a reason not to do it, because I say, what, I work 14 hours or 15 hours. They don't know how difficult it is to have a job and have this corporate job and all that. So the point is, at the end of the day, you live through it, right? Until and unless you live through this and you make it a part of your lifestyle, you will not be able to adopt, basically, right? So again, at the end of the day, it's become a very, very important part of our corporate culture, of our company objective and goals, where we are trying to incorporate this goal number 3 into our organization as much as we can.
So I can see it's almost like a straight line for you. You were doing whatever you were doing. I know you guys signed the Global Compact a couple of years ago. We were there together, and it's been a journey for you anyway, but a pretty straight line journey, because this is something that resonated with you. You're the leader of the organization, so you were to take a decision and say, "Samne karna," and then obviously you rallied support. Hajira, how has that journey been for you? You work for a conglomerate, huge organization, Nestle, everywhere in the world, products that we won't even go into. How has your journey been in convincing others that this is the right thing to do? Now, I ask you that question with 2 hats on. As a member of the Nestle team, but also as a doctor. So I know kind of what the answer is as a doctor. This is the right thing to do, right? So the business case is already there, because if it wasn't, then you wouldn't be there. And there wouldn't be need for a doctor in an organization. But more from a part of the team, senior team, what was your journey in convincing people that ye humne karna chahiye, ye health and well-being pe focus karne, like Umair said, there's already productivity, performance benefits, but just generally as a socially conscious company, so that others listening can think, Acha, Umair ke liye to ye aasan tha, he's the owner of the company, unhone decision le liya, ho gaya, job done, and he's got 100 people in his organization. Tell them what to do, right? And I know that's not the case on that. But Hajira, that's different, right? You work for a big company. How do you get the approvals and the budgets and all the other things, that go with it? So, and don't have to share everything. It's just to give people an insight. And it's okay, if you have these challenges. What's your journey been like? Has it been plain sailing? Did you say, humne ye karna, and managed were like, job done, theek hai, jaise hi keh rahi hai, ho gaya? Or were there some hurdles along the way that you had to pass?
Indeed, it's a great question, Zubair, and I would definitely love to answer the ups and downs, as well as the line how we walk on it. So, like Umair also said, the day he realized this has to happen, this change I want to bring in myself, that was the day when he changed. That was the day when he transformed not only himself, but the day he realized that this is good for the well-being of my organization and the people. He changed things for them. And then on, he changed things for himself also. This is how it started. I started it from the scratch. There was no
Okay.
health structure, right? So there was nothing around us. So generated awareness. To be very honest, I just worked 24/7, and I tried to visit every factory, every sales office, every head office, including
Mm.
everywhere which was Nestle site, just to go conduct few sessions, try to make them realize what health is all about. If this you will do today, what will it bring to you tomorrow? Until and unless that awareness is not generated within your own self,
Yeah.
no expenditure, no projects can be successful. Even if the company is ready to spend millions on you, you are standing where you are. So the
Mm.
very basic thing was that awareness that was being generated to the employees. And of
Okay.
course, then the changes, for example, in 2016, when my first health camp was there, we did it with a very renowned lab, Chuktai. So it was a health camp for all the employees that you can come, you can avail a 50% discount. It was an attraction for them, and you can get any investigation done on that particular day.
Right.
So if you say there were 100 people who attended in 2016, there were 1,017, there were 1,500 in 18. And when during the pandemic we couldn't do it, people were forcing me to do it because they were missing that bit. They wanted
Wow.
to know where do they stand. They were doing that follow up all by themselves. We were providing them a platform. The management was convinced, of course, because it was for the well being of their own people. Today, a healthy
Mm.
employee is, of course, we are not being selfish, but a healthy employee is more productive than somebody who has got a compromised physical or a mental health. And there are assets, to be very honest. A good organization is the one who always takes care of their employees, because if the employees are healthy, they are safe, they are sound, they are going to give benefits to the company. It's a natural transformation. So rest assured, it will come all by itself. So this is how we started from the basic things, then we started building on them. And today I'm very proud to say, because the measures and the SOPs we followed even during the COVID, Nestle Pakistan has got a very fewer number of those who were got affected by COVID. So it was because of that health and those practices and those hygienic measures, being it was respiratory hygiene, hand hygiene, workplace hygiene, social distancing, food safety, whatever measures we instructed them, they just trusted on us. They had that faith that reaching these things to us means that we have to go by it. So not only the SOPs were being in place, they were being respected by the employees. That's my success today.
Wow, excellent. And I think, it just goes back to one of your early points that, you had the courage, if I can use that word bravely, to say, "Bas ye karna hai," conviction, like Umair was talking about as well. And "Bas ye karna hai," you went with a conviction rather than a business case. And I think that's the beauty of the SDGs. It provides this lovely framework. It's already got the impact already identified or highlighted. And आप जा सकते हैं आपके management के पास कैसे बस ये करना है and let's just try it, and the impact is in front of you. And like you say, you've got advocacy from your own community. There's data to show that economies recover after calamities or natural disasters, or even in this case pandemic. Economies recover much quicker when you've got a healthier workforce. So not necessarily a healthier nation, but healthier workforce. It directly affects GDP. I don't have the numbers to mind, but I remember reading an article some years ago, back when I was in UNICEF, and it's about healthier economic recovery. I think it was Portugal. It's worth a Google search because it really puts some context into where we are right now and how significant having a healthier workforce, and healthier by mind as well as body. Really interesting article. So do get a chance. If people are listening and do that Google search, I think it's called Healthy Economic Recovery.
Right.
So you've both of you have identified that as individuals, you're championing this, which is great. And that's what we want to see within our networks in Pakistan and further afield. Businesses or organizations that are thinking of SDGs or already doing SDGs, they can step up the next rung of the ladder, as it were, become these role models and then move to becoming activists. And I know when I listen to you, Umair, and obviously we've met outside of kind of business as well, and I know how much you really champion us, look after yourself, and that really sends the right message across to people who are outside of the business circles. And also I'm getting that sense from you, Hajira, as well. So my question, or really my point is, I see this as an activation of collective impact. And I know, Hajira, you guys look at shared value, that agar hum sab milke kuch kare, so imagine the world that we could see, right? And if we make it specific to Pakistan and then our respective cities as well, and then our organizations, do you think that if we work, let me rephrase that, because I know the answer. Of course, working together makes sense. What could we do collectively? And this might even be a form of a partnership between Umair and Hajira in terms of business opportunities as well. You know, we really don't know. SDGs provides that framework. What, in your view, just very short answer, could we do as a community to achieve goal number 3? So Hajira, I'll start with you first. What do you think we can do collectively to advance goal number 3, health and well-being?
Okay, so Zubair, collectively, we can achieve so many things that we can even not dream of, but everyone has to play a part in it. It's easily said than done. That's the fact. So to begin with, I think whatever health projects our government is running, or for example, today we are in a phase where vaccination is needed. What as an organization, good organization, what we can do, we can partner with the government, we can support them not only in the execution but financially also. This is the little something any organization like Nestle, like any other company can do. So we can think on those lines. When there was a pandemic, people needed preventive PPs, they wanted masks, they want sanitizers, they wanted places where they can just run their normal day-to-day life activities or something. We can always organize that. So there are so many things and there are so many fronts where if we just all just share our we can brainstorm those ideas, and then we can have a platform where we can execute them as well. So
okay. Umair, what's your take on that? Saath milke hum kya kare?
Yeah, so I think, so just sort of taking or picking up the conversation from where Dr. Hajira left. So I think it needs to be, for it to be collaborative, I think what needs to be done is that it needs to be organized in a better way. So what I see here typically in Pakistan is that there's a lot of focus, especially, when the pandemic happened. I saw so many corporates coming together, everybody started to sort of focus on. But then what I did not sort of find, maybe it was, nobody knew really what was happening. But then now that we are slightly better, we have a slightly better understanding of what a pandemic is, and what sort of what can hit you, what do you need to do, how you're supposed to react. I think the efforts need to be distributed smartly. So the fact that the impact is bigger and it's more effective. So what happened was that, so it's a small example. So if people needed masks, then there should be distribution of that in a way where some people are doing PPEs while some people are doing masks, some people are doing gloves, some people are focusing on the sanitizers. It's not like everybody starts to focus on the masks only, right? Or just the PPE. So I think there has to be, and this is where I feel that the government needs to sort of step in and needs to have more confidence on the corporate sector, where they're able to delegate in a better way. And the corporates also have to come together. This is just an example, right? Like, I'll give you an example, like, when all this happened. So my group of friends, we decided that we wanted to do something for people who were underprivileged, or who we thought that people will not be able to sort of sustain this. So we put a model around it where some people focused on food supplies, somebody focused on the health supplies, somebody focused on, for example, the protective gear, right? And this is how, because it was a smaller community, we were talking about 8 to 10 people who were willing to invest or take this forward. But the same thing can be done at the government level in a much smarter way, right? So as we corporates are feeling the importance of the SDGs, right, especially the health and well-being, I think the same importance rather needs to be felt at the government level. And, I feel that in Pakistan, the situation gets a little more complex or complicated because, unfortunately, or fortunately for the provinces, unfortunately for the people, health is a very provincial matter, right? So suddenly, because I've tried to work with the government on so many initiatives, that, we work in the healthcare space a lot. We are working to disrupt the healthcare, vertical in Pakistan by bringing technology so that it democratizes healthcare for everyone. So everybody is able to afford good healthcare. The problem is that every time you go to the federal level, they say that, healthcare is a very provincial matter, right? Now, when you go to the provincial guys, they say we don't have any money, right? For example. So my view is that I think somebody needs to organize this in a better way. And I think these awareness sessions need to happen more, where hopefully next time you are able to bring somebody from the healthcare department as well, or health department from the government. There needs to be some representation from them as well to understand what are doing and how we can sort of join hands together to be more effective. I'm not saying that we're not. I think everybody is doing their part. I think everybody is overcommitting, I would say, but I think the channelization has to be better. Basically, that's my view on this.
I think you raised a valid point, and I think that lends itself nicely to goal number 17, which is partnerships. But I think this is where the UN Global Compact can play perhaps a role in convening the relevant stakeholders. Again, like you say, I don't see that literally happening overnight, where you bring everyone together and there's a conversation and that's it, kaam ho gaya. But maybe we could start that journey. We've got our gathering on the 30th of March, so maybe that could be the first time that we try and raise this issue and do that. We're almost at the end of our session. So just before that, I just want to just add a couple of points really and take your comments as we wrap up. Obviously, when we talk about good health and well-being, and particularly goal number 3, it's not just about looking after yourself. There are other underlying issues attached to this goal, which we need to remind ourselves of, obviously. And we know that before the pandemic, major progress was made to improve the health of millions of lives, in increasing life expectancy, reducing some of the common killers associated with child and maternal mortality, for example. But we really need more efforts, like you say, to look at the bigger things. Things from better healthcare systems, improved sanitation and hygiene, increased access to physicians, and significant progress can be made on that. I just wanted to share two targets from the 2030 impact indicators for goal 3, just to highlight that it's not just about being healthier in ourselves and looking after ourselves. There are a number of issues or a number of targets behind that, and I urge everyone to have a look through. So, for example, things like tuberculosis and malaria, and neglected tropical diseases in countries like Pakistan, perhaps. Preventable deaths on newborns and children under 5. That's obviously a highlighted issue. Reducing the global maternal mortality rate. Strengthening, obviously, the prevention of treatment for substance abuse, because that's prevalent in societies. And also, we talked about financial risk protection in terms of access to universal health coverage. So the Global Goal 3 actually addresses many of the underlying issues around health. Guys, thank you so much for joining us today. It's been an absolute pleasure listening to your insights. Ye conversation yahan pe khatam nahi hai. We have got so much more to talk about, and hours gone like that. So I'm going to invite you back at another session in the future to continue the conversation, maybe on this subject or another subject related to this. Certainly, you're both invited to participate in our upcoming gathering, the summit in Karachi on the 30th of March. And obviously, we have the UN Leaders Summit to look forward to in June. So just really in summary, I think it's been an absolute pleasure listening to both of you, your insights. You shared both your journeys, some of the highs and some of the lows, how easy and simple it can be to inspire other people, how you've made your organizations really become champions for change, but also, thank you to you for being those champions within your organizations. If you were not these change makers, your organizations may not be doing what they're doing on this particular goal. And we really need champions like you to sort of move this agenda forward. For those listening in online, again, like I said at the beginning, this has been a live session. It's recording. You can catch up and review, rewatch, listen again on YouTube and Facebook. If you are posting on social media, please do remember the hashtags, which are Uniting Business, SDGs, and obviously In Conversation With. Don't forget to mention all of us. You can connect with Umair and Hajira through LinkedIn. And we're going to continue these conversations. Again, we'll be back next month, same time with goal number 4. We're back next week on our Regional In Conversation with Naomi and Rachel on the Regional In Conversation series with Nigeria and UAE office. And that session is all about empowered women leading the change. Guys, any thoughts about one last point? What does your 2030 look like? So you wake up on the 1st of January 2030, apne subah ki chai bana li ya coffee, and you're thinking, right, job done. What's your wish? What does that world look like for you? Hajira, you go first.
There's so many things that cross your mind when you ask this thing. So to be very honest, being a health professional, would want that no pandemic should be around us, would want that everyone should be happy, everyone should be enjoying what they are doing. And we have got a better environment to breathe in, to be very honest. We have got better healthcare facilities. When we talk about Pakistan, we should have not been struggling for flu vaccine like we did this year. Being a third world country has got its own laws also. So that's a very unfortunate thing. So I just want and pray that my country and my fellow beings and everybody who is breathing in this environment and in this Pakistan should be healthy, should be happy, should be motivated to work. They should enjoy what they are doing today and later on also. And we should have got much better health facilities, caring people around us. Empathy should not be lost. People should not be that professional that they lose that connection of care, a smile on your face, those little words that can bring a smile on others. Thank you, I love you, take care of yourself. How are you feeling today? Just this one sentence is good enough to make somebody's day. So
I'm hearing, thank you. I'm hearing 4 key things there. So one is that you think that we need more doctors. So if there are any aspiring medical practitioners out there, please speak to Hajira. Maybe she can convince you to join the profession as opposed to going somewhere else. Certainly a better health healthcare system. And I think it goes back to Umair's point and your point earlier that humne sab milke kuch isme karna hai. So whether that's through using technology, physical facilities or preventatives, I think that's great. I think you've mentioned that we all need to be united, and I think that goes back to the formulation of the country. United we stand. So I think that will come through definitely, inshallah. And I think the fourth thing is just utter nice words, right? That doesn't cost anything. Umair, what's your 1st of January 2030 looking like?
Yeah, so for me, I think ideally, I want to wake up to this news which says that Pakistan is leading the sustainable goals. They're at least we're not leading, but at least we're we get global recognition that we were able to achieve what we were focusing on, right? And there is some achievement or some recognition around the fact that we were able to practice and implement and basically inculcate this into our society, right? So whether it's health and well-being, whether it's water issues, whether it's gender equality, whether it's poverty, we have, the fact that all the 17 pretty much are the problems that we foresee in our daily lives. Right? Maybe we're the privileged ones where we don't sort of suffer through them, but we do in some of them actually. But the fact that I want to wake up to this news where we're being recognized as a country who's gone and championed at least half of those goals, and we are actually our level has risen from, let's say, from an percentage to a Y percentage. The fact that if we are able to achieve that, then I guess we've addressed a lot of our problems, right? We will always have this year. We had the pandemic. There is no guarantee. What Dr. Hajira was saying earlier, that there is no guarantee that the pandemic won't come back or the vaccine will be effective But I think what we need to learn from this experience is the ability to adopt and change, right? And be prepared, be better prepared if, God forbid, something like this hits us again, right? And I think we need to be prepared and more ready, pretty much, you see. And the fact that, small things like where I'm talking on a global forum where somebody says and tells me that, it's very surprising to know that Pakistan still has malaria or still has polio and, all these things. So these are things that, I would want to wake up to know that, they don't exist in Pakistan anymore. And we're completely off and clean of these issues, these healthcare issues. So this is where, and these are things which, if somebody decides to put their mind to it, the public as well as a private sector. And what I was referring to earlier, that the collaboration needs to be more effective, rather than the quality needs to be there than the quantity, right? I think that's the most important thing for us as a country. We really need to start focusing on quality than the quantity. You see, I think we're always looking for shortcuts, right? So so I think that's where we need to focus on. We need to put a little more attention to the detail, right?
No, I think I echo most of that. I think you've highlighted that most of the SDGs in terms of their targets and the problems are actually prevalent in Pakistan. So we must have the solutions here as well, right? Absolutely. And I think you will see definitely Pakistan making more of an uplift in terms of the impact of the SDGs on the global scale. We've already seen that from our office and our contribution, and the fact that we're having these conversations. So we're already influencing the agenda at the global level. And last year we were we were part of the Leaders Summit, and then in UN Week as well in September. So Pakistan certainly has been given the spotlight, and then we're also launching the Voluntary National Review, which Pakistan, it's the second year, so that will shape what's happening at this year's General Assembly in terms of what the country is doing. And I'm pretty sure that we'll see some uplift there as well. But I think it just goes back to your point of how we need to work collaboratively. So that's our function. That's our office, that we're here to bring people together, help partnerships, broker relationships, and look at how we can move from conversation to action. And like I say, I go back to, our office can help facilitate that as well. Guys, thank you so much. Have a great rest of the day. Do stay in touch. Keep telling us about all the great stuff that you're doing. We want to feature that in some of our newsletters and share them with other people. Spread the word. Obviously, we'll post on LinkedIn as well, and then you can retweet, repost, or whatever you call it these days. And keep up the good work. So glad that you're championing this, not just for your organizations, but also the country as well. And we look forward to having many more conversations and inspiring others to action. Take care.
Thank you, Zubair.
Thank you so much. Thank you.
It's been a pleasure.
Allah Hafiz ji. Bye.